calls for South Africa to scrap its COVID-19 vaccination drive. NGO Transformative Health Justice says an independent investigation must be concluded and its results shared with the public before calling on residents to roll up their sleeves. Their concern surrounds the potential side effects and deaths caused by vaccines. Transformative Health Justice CEO Shabnam Mohammed and their legal aid advocate Sabelo Sibanda join us now to unpack this just very quickly for us. Shabnam, I'm gonna just start with you. Is your issue the COVID-19 vaccine in general, or is it the announcement made in December by the Health Ministry that 5-year-olds to 11-year-olds would also now start being vaccinated?
Thank you, Masego. So the Stop the Shots case, against the backdrop of international investigations into safety and efficacy, is essentially catalyzed by doctors in South Africa who are seeing serious adverse effects and have tried to report this to SAHPRA and the Department of Health, not to be heard since at least February last year. The announcement you shared just now regarding 5 to 11-year-olds certainly gives this case urgency, as does the fact that we've discovered that under 5-year-olds are being injected unlawfully. But the case is essentially based on what doctors and healthcare workers are seeing in terms of adverse effects. They're being ignored. We know our healthcare system is in a crisis. We know the electricity crisis adds further challenges as to whether these injections are safe or not. And so what we're calling for is for independent joint investigations into safety, efficacy, and the necessity, in fact, of these really exorbitant products that we cannot afford. And we're also asking the respondents in this case to declare their conflicts of interest as it relates to decision-making about the C19 injections.
So this investigation that you're talking about in the South African context, is there proof that you can give that people have gotten ill, gravely ill, or have died from being vaccinated?
Absolutely. So what we have is the clinical evidence by doctors in South Africa and, of course, around the world, thousands and thousands of doctors speaking out. We also have data and statistics, not only collected by SAHPRA, bearing in mind gross underreporting due to the challenges of our poor, for example, in reporting to SAHPRA and DOH, but also independently collected by SAVERS, a civil society initiative to collect data, which is, of course, analyzed by international experts. And they're saying that we have a basis to take this matter to court and stop the shots pending investigation into various areas contained in Part B of our application. My colleague Sabelo will speak to the precautionary principle, etc. But it's not a case we're bringing to court on a flimsy basis. We're being ignored by SAHPRA and by the Department of Health. We have no choice but to go to court to say, stop these injections pending investigation. Let's sit around the table and do what's in the best interest of our people.
Mr. Sibanda, can you just tell us exactly what you're applying for? Shabnam said you've been ignored by the department and SAHPRA. That would obviously be quite concerning for some South Africans. But can you just tell us in terms of your legal recourse, what exactly have you applied for?
Well, the most critical aspect that I will speak to is that related to the precautionary principle, as Shabnam has mentioned. What we are asking the court to do is to say, temporarily, whilst we wait for an investigation to be carried out, let's stop the jabbing of the people. And here we're talking about every South African who is deemed to be eligible to take the shot. But of critical importance being the issue pertaining to the children. Because what we are saying to the court is simply that, look, there is something that is happening out there. The doctors who are hands-on, who see patients literally on a daily basis, are saying we are witnessing an increase in the number of patients who have had the jab. And because of what we are seeing, we are very much concerned to have this introduced to the children as well. because we do not have the necessary evidence as yet that indeed this is not going to affect the children in the same manner that we are beginning to see with the adults who have taken the jab. There is a sharp rise, and therefore we are now asking the court to say, let's stop for a while whilst we carry out an investigation.
So there's a sharp rise in what exactly, Mr. Sibanda? How are they drawing the conclusion that there's a rise in exactly what? And how are they drawing the conclusion that it is linked to the jab? I'm just trying to understand.
There is a high rise of patients who are reporting to doctors manifesting various symptoms, some of which are unexplainable in as far as what the doctors are saying. And the common denominator is that this is happening in people who have taken the jab. By taking the jab, I mean those who have taken the so-called COVID-19 vaccine. Yeah. They are the people who have suddenly started to manifest these medical conditions which are a cause for concern. And so now we're saying that because of this rise that the doctors are reporting, it is necessary not to expose any other people to the possibility of suffering the same conditions. If this was being across the board, where across the board means to those who have taken the jab and those who have not taken the jab, then we would not be taking this kind of approach. The reason why we're taking this approach is because these conditions are peculiar to people who have taken the jab and to no one else. And more people are going to doctors with these conditions.
Yeah, all right. So you just want the department to halt the rolling out, at least until there's been an investigation and a conclusion that has been set out on whether or not these illnesses do directly link to the jab. So Shabnam, I'm just going to end with you because I'm running out of time. Is Transformative Health Justice an anti-vaccine company?
Absolutely not. We're a pro-safety and access to health, a non-profit organization. But of course, the other applicants include COVID Care Alliance and Save the Children. We're supported by thousands of experts around the world. We can prove causation. But I also want to share to you, Masego, that not one person who's affected by these shots has been compensated by the South African government yet. And the question arises as to why people are really suffering. And at the end of the day, we have a duty to uphold human rights and raise awareness about what is going on in terms of this medical product. We know the pharmaceutical industry has a long history of criminal behavior, and we're here to protect the best interests of the public.
Just very quickly also, have you been given a date as to when you're going to be, when this case is going to be heard and which court? Can you just give us those details if you have them?
Sabela, would you like to speak to that aspect?
Do you have the details, Mr. Sibanda?
We don't have an exact date for argument as yet, but the matter is before the DJP in Pretoria. As soon as we have every date in place, we will make it a point that you are informed and that the nation is kept informed, because this is absolutely critical for the protection of our children. There is no nation that can ever hold high any pretense to any moral values that is prepared to sacrifice its own children.
All right. Thank you so much. We'll try and also just get a hold of the respondents in your application, which obviously is SAHPRA and the Department of Health in South Africa. Thank you very much for your time to the both of you. That was Shabnam Mohammed and Sabelo Sibanda.